Sometimes a lot of pain that people actually go through could be pains that are induced by staying in a single posture for such a long time. Like if you are a typist, a secretary that work in an office, you always type in document, you tend to sit down. Your job occupation, your job specification is more of a sedentary kind of job. You don't move around. Likely you're going to have pains in your back, in your lower back, and these pains are occupational pains. And what you need to do actually for those kind of people is that from time to time, try to have a regular period of working out. Don't sit down in a place for too long, for like an hour, a maximum of an hour. Take out time, stretch your back, go outside, take a work. Because you don't want to leave the job because that's your source of income, right?
Of course.
So you've got to be there. So,
yes.
And because you have to be there, that means you have to try to modify the way you do your job. You can't just, if you're a banker and you're always sitting down in the cashier point, dispensing cash, writing this, you have to stand up at some point in time. You cannot just sit down in the same place from morning till evening and expecting that you're going to be okay. No. Have you ever been in a vehicle, traveling from a very long distance, and by the time you're about to come down, you can't feel your legs any longer?
Yes.
I
feel that.
You just feel numb, as if your leg's about to crack or something. Like, what's happening right now? Do I need to go to the healing school? All right. Now,
So that's a result of inactivity.
yeah, inactivity. And the blood flow to that area is reduced. Sometimes it could be a nerve compression also. So because when you're in a certain place, you're compressing some nerves that are supplying those areas. So those nerves could cause neuropathic pains. You're feeling neuropathic pains in those people. That's what's happening. So mobility is very important.
So when you have things like muscle pull, how do you, because I know sometimes it could be really, really bad. When you have muscle pull, you're not able to move.
And cramps.
Yes, and the cramps. So how do you manage such situations? I mean, where you are not able to assess the ginger, cinnamon at the particular time where you feel
Yeah, that's true. But which one is muscle pull? Which one is muscle cramps? There's one that really holds. We need
That
to.
holds you not able to move
And you're
at
not
all.
able. Is that what you call cramps, or is that what you call muscle pull? Which
cramps
is which?
actually happens when muscle cramps are generally just pains in the body.
Okay.
Those are
Generally
cramps,
pains.
okay.
It could be cramps in your legs, in your joints.
Okay. So those are
involving the muscle.
general body pains.
But when there's a muscle pull, in that term, you're referring to what it called. It has to do with lactic acidosis, accumulation of lactic acid in the body. Right, and something happens and some people exercise. It's a very severe and intensive pain.
I've experienced that quite a number of times, and I have to.
At that point in
stay
time,
there.
they would have to stay in a particular place for a while, rest the leg.
Yeah.
In some very severe cases, they may have to go to the hospital. Yeah, in some cases. Yeah, but usually it's happened because of lactic acid production, but excessive lactic accumulation in the body when it happens. And it's not a pleasant pain. It's very painful compared to just a general pain you usually have.
Yeah.
It's quite
So how
painful.
do we know that the lactic? You said it's as a result of lack of lactic acid.
Not lack of lactic acid, accumulation.
Accumulation. Okay, so what do you do
How
not
does
to
it
have
accumulate
an
in that?
accumulation
It
of
happens
the lactic
during
acid?
exercise. Some people, most of the time, during extensive
Oh,
exercise.
athletes. It happens to
footballers, for
athletes,
instance,
yes.
tend to experience it a lot.
Yes.
Or those running very long distance, they tend to experience the muscle pull a lot. Some of these activities help to release excess lactic acid that causes it. But it's not always common. It's not so common, but it happens from time to time in different individuals.
Okay, at what point should we raise an alarm that, okay, that could be possibly attached to an underlying condition?
Well,
so at one
they want to
point,
call you have to grade a pain, really. Some pains should be graded. There's certain pains that people have, and they're like, give me a painkiller. They're screaming, they're shouting, they're yelling,
Okay, so just before you finish that thought, we have King joining us from Lagos. Hello, King. Welcome to the morning flight.
Good morning.
welcome, King.
Good morning. Please go ahead and ask your question or contribution.
Okay, I want to ask, for ladies that use high heels.
Sorry, we didn't
What
get that.
is
King, you might need to speak up a little so we can get you.
Okay.
Yes,
I said,
that's better.
for ladies that use high heels.
High heels, okay.
Yeah. So what is the long-term effect of using high heels? Does it affect the, like Pastor
Waist.
Yinka there on set, I can see her shoes. So what's the long-term effect?
Okay.
High heels, a lot of times, the long-term effect of using high heels may not be much of a problem, especially when you don't use it every day. You don't wear
Okay.
high
Okay.
heels from Monday till Sunday, isn't it? However, for people who use it chronically because they have to slay,
Well, no.
Oh my
Sometimes
goodness.
it might not be because of that reason. Maybe
Well.
because of work ethics.
Appearance.
Oh,
Appearance.
the
How you want to
appearance,
work ethics, yes. I
the
mean,
kind of
but-
meeting you're going for.
Yes, so for some reasons, but however, some people tend to have some deformity in their heels.
Oh,
Yeah, for some people who use it very frequently.
wow.
Yeah,
Yes.
some people have pains and soreness in the area.
Okay.
Yeah, for some people, their ankle joint, for a while may become unstable, and also for some people, they have this. It's easier for them to actually fracture the ankle joint also because they can easily fall from the high heels. Yeah, it's easier. So basically, the pains, first of all, right? There could be deformities of the
heels.
of the sole of the foot.
Okay. Okay, but do you know, talking about the heels, there was a day I walked out, I went somewhere, and a doctor told me, he said, I should avoid wearing high heels. And I'm like, why? He said, because I'm tall. He said, because of my height and the heels, that it might affect my waist. How true is that?
Yes.
Well, I'm looking
Hello.
at you right now, and I wouldn't say that. I wouldn't say that's absolutely correct. I don't know why, because medicine is progressive.
Okay.
I can't say exactly what the source of its information for that, but
Okay.
I don't think that the kind of height is talking about you're in
Okay.
that category
Okay.
of people that
But does
should
height
avoid.
affect?
Should it be considered in the kind of heels you
No,
wear?
high heels. I don't think height should be considered
Okay.
on the
Okay,
kind of
so-
heels you wear. For some ladies, you're already tall, so they don't really need high heels because they're already.
No, it just
naturally
makes you
tall.
walk well.
Yes,
It's
and for
not
some
because
people also,
of
it
the height.
helps to give them a better looking appearance.
Yes, a balance kind
So,
of.
so what would you recommend for someone?
Okay, sorry,
that-
Joy, we have a call from Port Harcourt. Hello, good morning. Welcome to the morning flight.
Yes.
Please tell us your name
Yes.
so that we can get that.
Okay, my name is Matthew.
Okay, Matthew, welcome.
welcome.
Okay, so go ahead and make your contribution or question.
Okay, I want to find out.
All right.
Thank you so much for the enlightenment. Thank you, doctor, for what you've shared to us so far. I want to find out if a late night meal has anything to do with body pain. And secondly, you said there's another program that you
Yeah, it's
that has
called
to do with
Roots and
fruits
Spices.
all that. So I want
Roots
to
and
have an idea
Spices.
of when
All
you
right.
feature such program.
All right, you
Thank
can
you so
call
much.
the number for that particular program after the morning flight, and we're going to give you the schedule. It's Roots and Spices, and I'm sure there's a lot of education in that program for you.
Okay.
All right,
Thank
so
you
Doctor,
so
you
much.
go ahead to ask this question.
Okay. You asked a question about if
Late night
food
actually has
an
a
effect
relationship
on body
with
pain.
body pain.
Well, late night food, there are no research to prove that late night food has a pain on an effect on body pain. However, late night food could actually dampen the rate at which your body would digest it properly. And so people who eat late at night have a high incidence of obesity.
Okay.
And so when people are fat, most likely they may have one or two body pains associated with it. But generally speaking, late night food doesn't have any effect with body pain. It may just help to increase the weight of the person who is eating late at night, but it may not necessarily affect the body pain. There could be other causes of the body pain out of the late
But
night
I've
food.
seen some people eat late at night and they remain the same.
No, I mean,
Yeah, now that's different. Now that's different.
Why
Oh
does
my
that happen?
goodness.
Because,
we have individuals and we have different genetic makeups.
okay.
I know friends of mine who, no matter how much they eat, they never grow fat.
Yes,
The director of the show
Yeah.
eats late at night, and he's still the same. I've
Oh
known him
my
for so
God,
many
same
years.
yesterday,
so,
today, and
yeah,
tomorrow.
so why would that be different from someone else?
Because
the genes,
people's, number one, genetic, first of all,
Genetic
and
makeup.
secondly, the rate of metabolism. The metabolism of some
Okay.
people differ. And sometimes good to know your metabolic rate.
All right, Doctor,
If
we
you have a
actually
slow
have another
metabolic
call.
rate-
All right, hello, good morning. Welcome to the morning flight.
Morning.
Please tell us your name.
This is Maxwell calling from Lagos.
Oh, welcome, Maxwell. Maxwell from Lagos and Port Harcourt. Amazing. Okay, so Maxwell, make your contribution or ask your question.
Okay, Doctor, thank you for the enlightenment, especially the home remedies. I will sure try them at home. But I wanted to ask, what is the effect of long-term standing? Where I work, I stand for quite a long time. And I noticed that after a while, I started experiencing back pain, and it was very excruciating. At some point I had to lie down and take some painkillers. But I want to know, does it have a longer effect? Because I feel that the painkillers are just to reduce pain, but the pain, if I keep standing, because I need to walk, does it affect my back on the long term?
Okay, you're absolutely correct.
That's a very good question.
Long-term standing has an effect on your back.
My God.
Yeah.
It has an effect on your posture. They would
Wow.
also call postural hypertension.
Wow.
What it means is that for people who stand for too long, now this happens most of the time in those who are in the middle age to elderly age group. It could also happen in young men, but it's not so frequent. However, someone who stands for a very long time, the person could just drop down.
Wow.
The reason why is because there's a pooling of blood
Okay.
towards the limbs. So, the brain is the most vascularized organ in the body. What I mean vascular, it means that the organ has the most blood supply.
Okay.
So when you stand for too long, the blood sometimes could pull down towards the limbs, reducing the blood flow to the brain. And so the person becomes unconscious and drops down.
Wow.
You get it right. So for some people, as a matter of fact, that's one of the major complications of long-term standing. They could have postural hypertension. They could lose consciousness. Their blood pressure could drop so low, making them faint right there. They could also have back pains. All of this could happen as a result of long-term standing. So I want to advise, some of the security agents, I think that sometimes it's good that they tend to exchange the jobs. You have to be in the place you have to stand for too long. Have people you can always substitute with. No, you're going to stand for like 8 a.m.
To 6 p.m.
to 6 p.m. No, that would be good for you. That would be detrimental to your health.
Okay.
And it's going to have a long-term effect on your health, overall health, your muscles, your joints, your spine, all of this part of your body. And it's also stress on its own. We just talked about stress, right?
Yeah.
So that's a stress on its own, having an effect on your body.
Yeah.
Okay.
Thank you so much, Doctor.
Sylvia, I'd like to put the show, The Root and Spice. It's on the station on Tuesdays and Saturdays, 6 p.m. So yes.
So it's Tuesdays
yes,
and Saturdays by 6 p.m. So
6 p.m.,
Maxwell
6
in
p.m.
Port
on both
Harcourt,
days. Oh.
Tuesday, 6 p.m., Saturday, 6 p.m. Matthew, I'm so sorry about that, Matthew. But seriously, thank you so much, Dr. Joshua. But before we let you go, now, 1, 2, 3, 4, 5, 6 tips. When I feel a body pain, what are the first 6 things I need to do right there and then? Right now, let's take, for example, I feel a pain. What do I do?
Well, like I said, body pains, first of all, you must first. Now, these tips you're talking about, I'm trying to arrange it in my mind.
Okay.
Because really, they're different kind of body pain.
Yeah.
So let me just assume,
Okay, but just for a general
maybe
pain.
it's probably because you're stressed out
Yeah.
or something, or maybe you've walked out.
So let's make it 3 tips so people can remember.
Okay, maybe you've walked out a bit. First of all, rest your body.
Rest your body.
Yeah. After resting, if the pain is not going, depending on the kind of pain, you can use a cold compress in that
2,
area.
cold compress.
Then 3, try to exercise also. Exercise has a way to actually. You're talking about something about fibromyalgia, right?
Yes.
Exercise actually has a way of helping to ease pains in fibromyalgia.
Nice.
Okay.
Even though initially it may actually, you may feel like, oh my God, this thing is so difficult, I can't do it. But after a while, it becomes better by exercise. So exercise has a way to also ease body pains.
And you talked about water too.
Okay?
You talked about taking
Yes.
enough water.
Also get hydrated
Yeah.
as much as possible.
Yeah.
Drink water every day. In the morning, you wake up in the morning before you do any other activity like eating food, take a glass of water, you know, then drink as much water as possible during the day.
So you rest well, you do a cold compress, you exercise and take lots of water. Thank you so much, Dr. Joshua. It was indeed an educative and informative time with you in the studio today. Okay, now with all of that information, we now know what to do better. They say knowledge is power.